Hi, this is Danna Bowman. Thank you for joining us for another episode of Thyroid Refresh TV. I'm co-founder of Thyroid 30, here with my amazing partner.
Hi, I'm Ginny Mahar. I am also the co-founder of Thyroid Refresh and Thyroid 30, and we are so happy to be here today with Dr. Christine Schaffner. Welcome, Christine.
Yeah. Thank you so much for having me. This is so fun to join you today.
Yeah, wanted to tell everybody, so in case you don't know the lovely Dr. Christine Schaffner, she is a board-certified naturopathic physician who graduated from Bastyr University in Seattle, Washington. Very cool. She completed her undergraduate studies in pre-medicine and psychology at the University of Virginia in Charlottesville, Virginia, which is amazing. And she's in full mom mode. She just had a baby. So we're really excited to have her with us today. And her baby in the background, hopefully we won't hear her, but if we do, we're going to need to see her.
I know, right? We can bring her up. Yeah.
And bring her, because, yeah, right?
Thank you.
Oh, I love that. Well, we're going to be talking today about heavy metals, chemicals, pollutants, and the thyroid. So let's dig in. Can we kind of maybe start with the whole pollutant, environmental toxin, thyroid connection and why that's such an important deal?
Mm-hmm. Absolutely. And I think I'm so glad you've created your platform, because so many women and men are suffering with thyroid issues. And I see the thyroid gland as a huge area of focus because of actually where it sits in our body and how it is really susceptible to environmental toxicity. And as a naturopathic doctor, we're always trained to understand the reason why and look at the root cause. And I think, with this epidemic of hypothyroidism and hyperthyroidism and thyroid dysfunction, we have to look at, is this beyond a genetic, disorder? What is happening in our environment? And I just want to touch a little bit on the anatomy and how the thyroid gland is actually more susceptible to the increasing environmental exposure. And many people may know I work at a clinic called Sophia Health Institute outside of Seattle, Washington, that I co-created with my mentor, Dr. Dietrich Klinghardt. And he's been practicing medicine 43 years now. And we see patients from all over the country, and patients who have tried a lot of things and who have seen a lot of doctors and who have been failed by a lot of treatments. So it allows us to look outside the box. And why I mention that is because we're seeing, even in Dr. Klinghardt's, career history, he's seen people are more and more sick and more challenging to treat. We just don't take people off of gluten anymore, or, give them some methylfolate. It's a lot more complicated than that. And I think this environmental pressure that we're seeing, Dr. Pizzorno, who's also a naturopath, he wrote the book, The Toxin Solution. And he likes to say 1 + 1 doesn't equal 2 anymore. So we're seeing this soup of toxicity, and it's going to be very dependent on our own individual make up how we respond, to that. So when, to answer your question, looking at the environment, I'm always looking at heavy metals. I'm looking at persistent organic pollutants. We're looking at electrosmog. We're looking at the dental piece, and I'm happy to go through all of that. But for everyone to know, people who are watching know that the thyroid gland sits at the base of the throat. And some things that are really unique about the anatomy, this part of our neck is a huge highway. I think about it, it's kind of a highway in and out of our brain. And because we see a lot of people with neurological disorders, we're always thinking, how do we optimize blood flow in and out of the brain? And with that, we think about the arteries, the veins, the nerves, and the lymphatic system in the neck. And then the thyroid gland, where it sits, it's highly vascularized. So that means there's a ton of blood flow at all times going in and out of this gland. And it's also innervated by a branch of the vagus nerve, which is our 10th cranial nerve, which is a huge part of regulating what we call our autonomic nervous system. And that nerve is also very susceptible to toxicity. So all of these toxins that we'll talk about are neurotoxic, that actually affect the functioning and communication of these nerves. And that can affect actually how the thyroid gland receives information and receives blood flow. And then we always think about the lymphatic system, and I think in alternative medicine, many people know about the lymphatic system, but it's very often overlooked. And the lymphatic system is kind of a waste cleansing system where our body especially removes toxicity out of our bloodstream. And we have a lot of lymph nodes in the neck. So if our lymph system is congested, the lymph system works really hand in hand with our arteries and our veins. So if it's kind of this domino effect, right? If one system isn't working, it's going to have a ripple effect. And so if we're not having good blood flow, we're going to have a congested lymph system, and then toxicity is only going to build up. And then that's also going to be an area where infections thrive and are not, addressed as well as they can be by our immune system. So I can talk about more things, but that's just the backdrop that I would like to look at, is where the thyroid sits. It's in the epicenter of a huge area of our body and a really important part of our anatomy, and then how things upstream and downstream can actually affect the thyroid gland as well.
And I stop you really quick because you did a great job explaining how the lymphatic system works and how it affects everything. But I didn't realize when I was younger that it really was like the garbage disposal kind of thing for brain, for neuron, for things that are used up in your brain. Like, can you talk a little bit about that? As I don't know what the words are.
No, absolutely.
To me, that we have to really process things and get rid of them. Like, I don't think people really understand that piece. It's not really related to thyroid. Will you talk about it for just a minute?
Absolutely. And I think as a naturopath and, looking at the root cause of, illness, the body is always trying to maintain homeostasis. And when there's stress, we're always trying to rebalance. And one of the biggest stressors that we have is this overwhelming toxicity, and our body knows how to get rid of it. But if it's overwhelmed, that's where we see disease. So a lot of times we focus, of course, on the immune system, but we're always trying to improve our body's ability to detoxify. And that usually leads to reversal of symptoms. And so what's really exciting is in 2015, it was very new. I mean, we've known about the lymphatic system, but we were educated about the lymphatic system. Actually, University of Virginia was one of the institutes that brought this information to light, but it's this waste clearance system in the brain. So, and this is kind of related again to the thyroid in the neck, because what happens at night is the brain actually shrinks 60% in size to make room for the flow of lymph going through the brain. So what that means is that the lymph system is going to bring nutrients to neurons and eliminate waste and toxicity from the neurons. And then the lymph system actually piggybacks on the venous system. So it goes, flows along the veins at night. So basically has to, exit the brain through the neck and the jugular veins. And so if the lymph is congested here in the neck, again, the thyroid sitting right here, that's going to only increase lymph stagnation in the brain. And then our brain isn't going to be able to self-clear toxicity or metabolic waste. And what they found actually is a few things: that the lymphatic system helps to clear amyloid beta out of the brain. So amyloid beta, there's a lot of research of why it actually builds up, but there is that relationship. The more amyloid beta, the less the neurons are able to communicate, and the more neurodegeneration we see in a condition like Alzheimer's. But we also see, that if people have had a traumatic brain injury or a head injury or concussion, that actually affects the lymphatic system. So that's why we see the NFL players have more incidence of dementia and Alzheimer's disease. For me, like a huge light bulb went off. I mean, with the patients that we see, I just feel like this is such a foundational piece of why we're seeing an increase in neurological illness, and how we can actually treat neurological illness from this removal of toxicity and improving lymph drainage in the brain. And then that just flows into the rest of the body. The brain will flow, the lymph will drain into the neck. And so if your neck is congested, if the rest of your lymph system is congested, then that's not going to have, we're not going to get as much removal of lymph as we could if the lymph system was flowing. It's kind of like a hydraulic system, if you can think of it in that way.
Wow. Right?
I'm just sitting here with my mouth hanging open. Like, this is so incredibly fascinating. So my number one question is, okay, how do we support that lymphatic flow and drainage, and what can we do?
Yeah, great question. So, again, a lot of our chronically ill patients have this congested lymphatic system. And, what we like to look at is, okay, how the lymphatic system works. And so the lymphatic system really is reliant on the pressure differential between our arteries and our veins in the capillary bed. So it needs that movement of blood flow to actually have the lymph kind of drain into these lymph vessels. And the more that they're studying the lymph system, the more that we're realizing it's not, this, we don't have these discrete lymph vessels. I mean, there's a lot more lymph drainage happening in what we call the connective tissue. So we're only, what I'm just trying to preface is we're learning more and more about the lymphatic system. But what we do know is that movement is a huge piece. So there are some really simple tools that patients can do. Gentle walking. There's something called a rebounder that can, I'm on a little bouncy ball right now sitting, but like just the gentle movement of either a rebounder or on an exercise ball gets your lymph system moving. And then there's also dry skin brushing that can be helpful.
Do you mind me stopping you there? Because I hear that a lot. How exactly does that work? Because it's hard to imagine, you're dry brushing your skin and it just, it doesn't quite.
Yeah, no, it's a great question. And, before I just share that, I want to also share that one of the things that we've learned at Sophia is that we were trained by a German practitioner in a treatment called Sophia Matrix. It's a lymph drainage technique that we've gotten a lot of amazing results. And her whole philosophy is that if the lymph system does not drain in the gut, then the rest of the extremities cannot drain. So your head can't drain, your arms and your legs can't drain. The epicenter of our lymphatic system is in our gut. And so we know that a lot of people are struggling with constipation and gut inflammation. And, there's a huge immune system in the gut. And then if the lymphatics, we have a huge, if you Google lymph system in the gut, you'll see all the lymph nodes in the gut, in the lymph system. So what we try to do is actually create movement in the gut. And if you don't have access to a practitioner who can do that, castor oil packs, just making sure you're having good bowel movements, coffee enemas, all of those things can get the lymph system in the gut moving. And then the head and the neck and the legs can drain. And so why these techniques work is it's creating that gentle movement that actually the lymph system needs to actually get recirculated. And so again, it doesn't have its own valves or pressure system. It's reliant on our movement or on a well-functioning circulatory system. So if those aren't happening, these gentle techniques can actually create a lot of momentum for the lymph system.
Wow. One thing you mentioned was, the infections, and are you talking about like strep throat and things like that?
Yeah, so we look at, again, chronic infections, toxicity, epigenetics, trauma. We try to look at this whole big picture when anyone's sick. And when we look at chronic infections, you bring up a good point with strep. I want to also think about the lymph system and the throat. So we have our tonsils that are a huge piece of our immune system. And our tonsils are not just what we call our palatine tonsils, which are the tonsils that we all kind of know about if we have our sore throat. But there's this whole lymphatic ring. It's called Waldeyer's ring. And there's our adenoids that sit at the roof of our mouth. There are tubal tonsils at the base of our eustachian tubes and in the inner ear. There's the lingual tonsils underneath the tongue. And then there's some tonsil tissue around the larynx. And so this whole tonsil tissue, if that is chronically stressed by a chronic infection, that's also going to stress the lymphatics, because the brain drainage actually goes through the cribriform plate in the nose, and that drains through this Waldeyer's ring, and then it gets into the throat. So if that's chronically inflamed or congested, that's going to impact the lymphatic system. And then you guys probably know Cyrex Labs and Dr. Voshani, and I was listening to a talk when he came to Seattle, and there was another light bulb moment for me where he talked about, we look at a lot of children who have this autoimmune reaction that's happening to infections in their tonsils that creates inflammation in their brain, and it can be secondary to strep, but it can be to other infections. And what he has found as if the immune system is stressed in the tonsils, there's an upregulation of an immune cell called a Th17 cell, which serves a purpose, but it actually, from this place, it can actually go through the cribriform plate into the brain, so these cells can migrate, and then they're trying to do their job, but they're getting turned on, so they're creating too much inflammation in the brain, and that can trigger an inflammatory process in the brain. So why I go into all that is because, it's a lot is happening here. And if we have a chronic infection where the immune system is stressed, it can lead to not only our lymph system being overwhelmed, but it can also lead to inflammation in the brain.
That's a lot to take in.
Sorry. I'm
passionate, right?
I'm passionate. And then there's, I go back to work on, Monday. I've been out of the office, for 12 weeks, which is hard to imagine. But yeah, this is just, this is our work. This is what we do all day. And we see patients who are looking for answers. And, what Dr. Klinghardt has taught us all is how to be detectives and to not settle for not knowing, and to always, there's always a reason, and we might not know it at the time, but, science will catch up, and, that will be revealed. And I've just been doing that for 8 years. And in that time, it's amazing what we've learned, and also how our theories also, it's something that we'll see clinically and we'll act on sooner than a paper will be published. And then over time, we'll see that science supports what our patients
catches up.
Yeah.
Catches up.
So,
right?
and it's, I think the role of a doctor, any practitioner, is just to listen to our patients. And, our patients are always telling us why. We just have to put the pieces together and have a perspective. So.
Really quick, before we move on, I want to just say this because it's interesting to me. I know so many people when they were younger who got their tonsils out.
Mm-hmm.
And I'm kind of feeling like I'm so glad I didn't.
Yeah, it's like a double-edged sword. It's one of those things where, we don't want to take anything out unless it really needs to be. And I think that there was definitely a time where it was definitely more in vogue to take tonsils out for really minor reasons. We do see in our patients, our kiddos who are struggling a lot, that actually the removal of their tonsils can actually be helpful. There's kind of a point. I believe that the body can always heal, but like at what cost and at what time are we going to be willing to wait for that? And for some of our kiddos who are so sick in this PANDAS picture, actually the removal of this really diseased tissue is going to give them allow their immune system to catch up. So, as a naturopath, I'm not all for surgery or anything, but I've seen, when it's done properly, it can be very helpful, but it was definitely overdone in the past. Mm-hmm. And when you have, just to let you know, when you have scar tissue from a tonsillectomy, that can impair lymph drainage in the brain. And so we do a neural therapy technique where we actually inject the scars in the tonsils, and that helps to break down the scar tissue. But there's other ways to do that. But it's just, I'm glad you brought that up, because if you have had your tonsils out and you are struggling with any of the things that, we all talk about, how to improve this lymphatic area and break down the scar tissue in the back of your throat can be, really, really helpful to that. I just want to share one other little pearl around that. So the scar tissue in the back of the throat is really close to a ganglia called the superior cervical ganglia, which again, these are fuse boxes in our nervous system. Just think about it in that way. So that scar tissue can be actually pulling on that ganglia and affect the communication, and that ganglia speaks to our pineal gland, and so that can actually affect blood flow to our pineal gland, that actually can create chronic insomnia. So sometimes people can have what we call a tonsil interference field that's relating to their insomnia. And then when we treat that, they feel better. Yeah. So there's all these and I didn't make any of this up. This is all, this is all, from neurotherapy in Germany where it originated. So I've just been, taught with this layer, and it's amazing, how we see that clinically be true over the years.
It's so amazing how it's all connected.
Mm-hmm. Right. And that would be my message, is, we think, the thyroid gland is just this isolated endocrine gland, if it's imbalanced, then just treat that. But you have to look at this in the, in the rest of the communication in the body, and everything's related.
Right. That whole health picture is just endlessly interesting and empowering to learn about, I feel like. Can we kind of come back to the toxin piece and the thyroid now that we've come to such a deeper understanding of all that's going on in this area of the body around the throat, and lymphatic and glymphatic, and how all of those things come into play? How do toxins come into play there with the thyroid? Which toxins? What do we need to especially avoid? Things like that.
Absolutely. And I guess I'll just start with the mouth, because I think that's another thing that's overlooked. A lot of conventional dental practices are actually very toxic to the body, and some people don't do well with them at all. And we always do a dental history when we see a new patient, and we look for amalgam fillings, which are an amalgam of metal, including mercury, which is a known neurotoxin. And mercury can be very poisonous to the thyroid gland. And if you can just think of the teeth and the proximity to the thyroid, and just all the things that we were just talking about, the nerves and the blood flow and the lymph system. So mercury can very easily get taken up into the thyroid gland if you have an amalgam filling or multiple amalgam fillings. And so step one would always be to remove amalgam fillings with a safe dentist. You only want to work with people who do this all day long, so you don't increase your exposure to mercury. And so there's a website called IAOMT.org, and they train dentists in the safe removal of mercury. So that's one thing to think about. And you never really want to detoxify your body or work on heavy metal detoxification if you still have amalgams in. That can actually be, you can actually create more harm than good.
Wow,
and so
that's interesting. I did not know that.
Yeah, because if you're using agents that are grabbing or pulling, and you have mercury in your mouth, that could increase the exposure of mercury in the body. And so, and I see that clinically all the time. We kind of are at this position. I mean, we'll work with anybody, and meet them where they're at, but we really try the first step. If a lot of our patients know about this before they come, but we try to do safe removal of amalgams before we even get started, because I find that patients are a lot more sensitive and reactive, and your hands are tied in treatment if they still have amalgam fillings. And this is again for our patient population. So that's, I think, still there's a lot of awareness around that, but I think it's still very much overlooked. And so that's a big piece. And then the other toxicity piece in the mouth is root canals. So root canals are dead teeth that are basically filled with non-biocompatible material often, and that can harbor infection over time. We all know that if we have bacteria in the mouth, that can lead to, like if we have gum disease or any overgrowth of bacteria in the mouth, that can lead to heart disease, that can affect us systemically. And so what can happen is these teeth can become what we call a focal infection. And that can actually harbor harmful bacteria that can enter, our bloodstream and can affect us systemically. From an alternative perspective, and also in a German perspective too, each tooth sits on an acupuncture meridian. So, if you have, let's say, the front teeth are actually kidney bladder meridian. So let's say you have chronic urinary infections, urinary tract infections. Not to say it's the direct cause, but can that system heal while there's a chronic infection in that tooth? And so I've seen when you clean up the mouth with a associated meridian tooth, that actually the body heals. There's a thyroid tooth as well. My baby brain, I can't remember it. It's one of the back molars, but there is a relationship.
I think you told me. Wait, hold on. I think it's the back on the left side. I think I remember that part.
Yeah. So
right?
there is a thyroid tooth. And so we can easily look that up. I just can't remember off the top of my mind, but just, sharing all those relationships. So we look at amalgams, we look at root canals, and then we look at, sometimes there can be infections in the jawbone after the wisdom tooth, is removed improperly. And so that is another source of, toxicity. So we look at, there's something called biotoxins. So the toxins that bugs produce that can also have a toxic effect. So the cavitations can be a source of biotoxin exposure. So the mouth is a really big, piece. So if you haven't gotten well and you've tried a lot of things, just go through your checklist and then work with definitely don't tackle this on your own. If you want to ever work on your mouth, you have to do that with very skilled providers. Even the best doctors can, run into increased symptoms and flares that we're all trained to deal with, when you go through something this big. So just please don't do that without the right guidance. And then, looking at other heavy metals, we're always looking at mercury, lead, and aluminum. Of course, there's arsenic, cadmium, there's more thallium exposure now, but those seem to be the big ones from the perspective of neurotoxicity. And then again, that's going to affect the innervation of the thyroid gland and then the thyroid gland itself. But there's a lot of research on mercury and thyroid dysfunction. So that's heavy metals. And then, glyphosate is the active ingredient in Roundup. And that can be, this herbicide exposure can actually damage the thyroid gland. And then there's a class of things called organophosphates, and those are going to be other pollutants. One is they're polychlorinated biphenyls, they're PCBs, and that chlor part is chlorine. And if you think of the periodic table from chemistry way back when, the halogen family is where iodine sits. And so the thyroid gland uptakes iodine. It's the only gland that uses iodine in the way that it does. And so if you're exposed to chlorine, there's enough similarity that it can actually mistake that for iodine and then interfere with the functioning of the thyroid gland. And then another thing to think about is this, we consider a toxin is this electrosmog exposure. So what that means is our Wi-Fi, our cell phones, are increasing exposure to microwave radiation. And when you can think about the thyroid gland, when we're in our screens, when we're at the computer, the thyroid gland gets heavily exposed. And then if we, hopefully many of your listeners know not to put their cell phone close to their body or their head, but to use speakerphone or to use the earphones that have the rubber tubing. But that can also affect the thyroid gland. And so that's a whole rabbit hole to go down. But, I think more and more awareness is increasing about EMF exposure and how, technology allows us to do these wonderful interviews, and it serves a huge part of all of our daily lives, but how can we interact with this technology in a safe, mindful way? Because there's a cumulative exposure, and we're not getting that break or repair restorative time that we once did because we're all exposed to this 24/7.
Right. These are really unprecedented times, aren't they, for the things that our bodies are exposed to?
Yeah, absolutely. And I think that's where, we just have to take a step back and, from the point that we're all sitting, we see this rise in autism and Alzheimer's and chronic illness. And, we're just in a unique time right now where there are a lot of these factors that have not been studied in combination. And, we're ultimately the experiments right now. And I believe that, our bodies are a window into, what's happening in the outside world. And so when we see also with our environment changing, climate change, the earth really struggling because of a lot of our choices, that's also impacting, our bodies, I believe.
And it's so important now, with all the things you just said, to try to get some nature time, really, really important. Like I know people are like, oh, grounding or oh, this, or but really like to where you're outside. Because you can't really escape the wires and the, if you're outside and you're in the grass or by a tree or, at Jenny's place, she's got a lot of, property and things around her. Hiking and getting out really does help break that, helps let you start repairing and restoring from all the things that are always coming at you. People, I think that they don't realize how important it is. And there's no way we can stop and restore if we don't connect more to nature.
I believe that. Yeah. And I think nature is very intelligent and wise. And there's a lot of restorative energy that the earth offers us if we interact with it.
This is kind of a scary question, but this is something that's been kind of dinner table conversation between my husband and I is, do you think, you know, in these unprecedented times where our bodies are exposed to so many toxins, you know, electromagnetic frequencies, environmental toxins, you know, things like glyphosate, all of that, is this like, are we as thyroid patients some of the canaries in the coal mine for, you know, a time when we're going to come into like almost an evolution of the people who make it are the ones who can handle all these toxins?
Yeah, you know, I think that's a really you know, important reflection. And I see our patients as canaries in the coal mine, you know, for sure, you know, and, you know, I look at it from both ends of the perspective. You know, a lot of times, you know, our patients are like, oh, I have compromised detox pathways, you know, I'm struggling, this and that. I'm like, your body is actually smart and screaming right now, and just screaming that it cannot withstand this level of stress, you know. And a lot of us think that we might be immune to it, but it shows up in other ways. I mean, I think you probably see this too. There's a, you know, what Americans or what people consider healthy right now is a very interesting reflection, right? You know, there's an increase in depression, anxiety, insomnia. Would people consider themselves healthy with those things, or that they're not affected, but, you know, then they develop cancer, or they develop heart disease, or, you know, all of these things that they think happen because of other reasons. And I think that we're all affected to different reasons. I think the people who are affected in our patient population, the people that you talk to, very much so are the canaries in the coal mine. And I think I'm ultimately, even in this position, I'm ultimately optimistic, and I do believe that we have an opportunity to shift things, but it's going to take a lot of grassroots effort and awareness and education, you know, but I do feel that the people who are sick have the opportunity to really heal and transform on a deep, profound level. And that can also be a wake up to how do we make different choices in our lifestyle and, you know, as a society.
Well, we definitely can speak to the power, you know, from a patient perspective anyways, of those diet and lifestyle changes. I mean, I have absolutely reclaimed my health and lowered my antibodies by doing that.
Yeah.
You know? And I know I'm not the only one, and it is empowering and hopeful. So
yeah, and
for pointing that out.
Absolutely. And I, just to add to that one piece, I mean, the hardest part, I think, of my job is to see these amazing people taken out of life, right, for decades, you know, just with a chronic illness. And, you know, I love my work, I love my job, and I couldn't imagine not being able to live in my passion and purpose. And I see that, you know, from a patient perspective. And, you know, you guys are examples of taking, you know, a pretty severe health crisis and transforming, looking what you've created, you know. And I think that's always, you know, of course I want people to feel better, but when they kind of take this whole other transformation and level of meaning into their life and create an impact, I mean, that's the thing that, you know, just feels amazing to me.
Definitely.
Aww.
I think
Thanks
so
for
too.
saying that.
Yeah, that's nice.
Yeah.
One thing I was going to also point out is that, you know, it can feel so overwhelming. And so to take, you know, baby steps or to try to balance things, you know, like I'm thinking, what about all the toxins in your home and your furniture and your carpet and all your products and your paint and your finish on your door? I mean, there's just really so much. And so that can be overwhelming. And we're all about trying to take out the overwhelm at Thyroid Refresh and Thyroid 30. And so, like, as opposed to, you know, kind of maybe freaking out about all the things you need to get rid of, What are some positive things you can do? Do you have a few tips for people so that we can try to, make it not so overwhelming?
I know. When you listen to kind of all the things that I just said, unfortunately, it can be very overwhelming. And I don't want people to become paranoid either, because that creates a whole other energy that's destructive. But it's, I think you're creating a great point of how do we feel empowered and just break this down one by one. And how do you add health to your life and then the unhealthy things, fall away? I mean, one thing that I could just share is, maybe focusing on your bedroom and your sleeping location. That is a huge place where your body and your brain is going to restore, repair, and you're going to, there's so much research coming out about sleep and, how it's imperative for a healthy brain and our lymphatic system, but also for our immune system, stress reduction. Sleep is really important. And so how do you create a sleeping location that's going to be, quote, safe from all of these things, right? So how can you, I like to make sure that people, don't have their electronics in their bedroom and, don't have anything plugged in by their head because of the magnetic field that can create. So just cleaning up, having it be maybe a device-free zone, and that's maybe step one, and that is, good enough. And then over time, you can just maybe every month add to that. So, from using linens that are going to be a little bit more healthier and then there's all sorts of bedding material and things that you can do, but also just making it feel good. How do you make what does that mean to you? How does this place inspire relaxation and a restorative environment, making it fun?
I've been hearing so much about fragrance too. And I think that can really come into play in the bedroom, just a fragrance-free detergents and things like that, getting rid of those plug-in air fresheners. And
it's huge. Yeah. Those, one of the things that people don't realize is fragrance is a very unregulated ingredient part of when you look at the list of ingredients, you can just write fragrance, and because it's proprietary, they don't have to list everything in there, and there can be up to 200 ingredients in that fragrance, which many of them are neurotoxic. And so it's amazing when you create a fragrance-free environment and then you interact with those fragrances again, your body signals like, that's not good for me.
Oh.
And so, so
and even my kids, notice,
walking down the aisle at the grocery store last night, I was like, I got to get out of here. I mean, it was just this overwhelming
Clorox
of perfume from the detergents and cleaners and things. It's just...
And, flipping that and using more natural fragrances, right? Essential oils, are, designed to interact with our brain and our nervous system and to create a calming effect. And so using, simple things like lavender or whatever you enjoy. But there's room sprays and oils that you can put on your body or in your bath to de-stress at night and actually have a healthier experience of, fragrance.
Well, thank you so much for being here, Dr. Schaffner. This has been just beyond fascinating, and we really appreciate you sharing your knowledge with us and bringing this to the thyroid community. It's so incredible to know, and so thank you for being here.
You've kind of brought our attention to not taking some things for granted, and root canals and things like that. I think many more people should be out there saying it too. I'm glad you are, but thanks for bringing the awareness to some of those things, because it's a really big deal, and we need to heed the message.
Yeah, absolutely. And thank you so much for your work. And I'm excited to learn more about your new platform. And this has been really fun.
Thank you. Thanks so much.
Thank you so much. And thank you to all the listeners and viewers out there. This has been another episode of Thyroid Refresh TV. So thanks for watching.